Hello dear students, your today's topic is asphyxia of the newborns and intrauterine hypoxia. What is asphyxia? Definition of the asphyxia is incapacity of newborn to begin or to support or spontaneous respiration after delivery due to breaching of oxygenation during labor and delivery. Definition: asphyxia in Great Britain. Asphyxia is critical insufficiency of oxygen in fetus during delivery. So severe that leads to development of metabolic acidosis and depression of spontaneous respiration. Definition of asphyxia. From the Greek, it means a stopping of the pulse. A clinical definition to be used for patient care and epidemiological studies. A research definition to be used for current and future neuroprotective studies. Okay, asphyxia means to be pulseless, but more useful is a definition of impaired or interrupted gas exchange. The situations can take place intrauterine, intrapartum, and postnatal. First one is intrauterine. The gas exchange depends on the function of placenta and the blood flow in the umbilical vessels. Postnatal, after delivery, the gas exchange takes place in the pulmonary vesicles or alveoli and depends on the function of the heart, lungs, and brain. Causes of asphyxia: fetal hypoxia from mother side, hyperventilation during anesthesia, cyanotic heart disease, respiratory failure, or carbon monoxide poisoning, low maternal blood pressure as a result of the hypotension that may compression of the vena cava, aorta by the gravid uterus, inadequate relaxation of the uterus to permit placental filling as a result of uterine tetany caused by excessive administration of oxytocin, premature separation of the placenta, impedance to the circulation of blood through the umbilical cord as a result of compression or knotting of the cord, uterine vessels vasoconstriction, placental insufficiency from numerous causes including gystosis, eclampsia, preeclampsia, toxemia, postmaturity, and extremes in maternal age, less than 20 years or more than 35 years. Intrapartus asphyxia. Causes of intrapartus asphyxia: more frequently inadequate obstetric aid, using forceps, vacuum extraction, crustellar, cesarean sections, trauma, narrow pelvis presentation, extremely rapid or prolonged labor, multiple gestation, and meconium-stained amniotic fluid. Postnatal hypoxia. Anemia severe enough to lower the oxygenation content of the blood to a critical level due to severe hemorrhage or hemolytic disease. Cell pathology. Heart rate, breath movements, and blood pressure in fetus during primary and secondary apnea. Virginia Apgar. You should know about Apgar score of the newborn in asphyxia, heart rate, respiratory, muscle tone, reflexes, grimace, and skin color. Criteria for severe asphyxia: severe metabolic or mixed acidosis, pH less 7.0 in arterial blood of umbilical vessels. Assessment by Apgar is 0 to 3 during more than 5 minutes, Neurological symptoms such as general hypotonic lethargy, coma, seizures, damage of vital organs like lungs, heart, and other, in fetus or newborn. With complications associated with asphyxia, hypertension, hypoxic encephalopathy, seizures, persistent pulmonary hypertension, hypoxic cardiomyopathy, ileum and necrotizing enterocolitis, acute tubular necrosis, adrenal hemorrhage and necrosis, hypoglycemia, polycythemia, disseminated intravascular coagulation. Diagnosis of asphyxia. Clinical symptoms includes clinical symptoms, metabolic derangement, renal or cardiac failure. Assessment of the brain, EEG, is useful particularly in the asphyxiated term newborn. Ultrasonography, computed tomography, intrauterine assessment, ultrasound and Doppler technique, electrophysiological, and extrauterine assessment, biochemical analyzing. Differential diagnosis, maternal infection, congenital syndrome such as myotonic dystrophy, inborn errors, and stroke. Treatment of asphyxia. ABCD resuscitation. What is ABCD? A, it means airways. Maintenance of passableness of airway. B, it is breathing, stimulation of breathing. C, it is circulation to support circulation. And D, it is drugs. Step A. Immediately after delivery, the infant's head, shoulder, we place it in a neutral or slightly extended position. Roll it towel under the shoulders. Immediately after delivery, the infant's head should be placed in a neutral or slightly extended position, like this picture. And airway established by clearing the mouth, then the nose by rubber bag. If meconium is present in amniotic fluid after sucking of mouth and nose, we must suck a pharynx by tube after laryngoscopes. If it is inadequate, we must use step B. At first, the tactical stimulation should be given to newborn, for example, gentle flicking of the feet or heel, or rubbing of the back. If these measures are inadequate, mechanical ventilation should be initiated using mask and back ventilation. If ventilation is adequate, supplemental oxygen may be given to improve heart rate or skin color. If mechanical ventilation doesn't improve the respiration, heart rate, or color skin, the following step is C. It is circulation. At first, the assessment of heart rate is necessary. These chest compressions with 2 fingers and with 2 thumbs. Your big fingers must be lie on the sternum. Other fingers should lie under the back of newborn. And prognosis of asphyxia is difficult because of the inability to establish the precise extent and duration of cerebral insult and injury at the time of delivery. Low delayed Apgar scores between 0 and 3 at 10, 15, and 20 minutes of age are associated with significantly increased mortality and morbidity. Cerebral palsy. The single most useful prognostic factor is the severity of the neonatal neurological syndrome. Thank you for your attention.